42-year-old male, Sam Wallace, blunt head with agonal respirations. Dropped down on the T-tracks. Couldn't tube him, LMA in place.
Suicide attempt? Rescue.
This chap here is in very bad shape. Blunt force trauma to the head and now agonal breathing. So these are irregular gasping breaths that people have right before death. Agonal breathing is not going to sustain life. So they've tried and failed to intubate him, and instead they put an LMA in place. So this stands for a laryngeal mask airway. So instead of a tube into the trachea, which can be hard to insert, this is a device that has a mask that fits over the vocal cords and has a cuff that inflates to help keep it in position and help you ventilate the patient.
I need you on the eat fast. Pupils 4 millimeters and reactive.
Okay, that's encouraging.
Great. Okay, so the chap that's had the traumatic brain injury, we learn has normal pupils, so 4 millimeters and reactive. This is a good sign, as the main concern here would be if he's got intracranial bleed. So a bleed that's expanding in the skull and squashing the brain, and that's what's causing his low conscious level. If this was a bleed and the pressure continued to increase, this would squeeze the brain out the bottom of the skull, what we call brain herniation. This is a near terminal event, and at that point you'd start seeing the pupils becoming dilated, so wider and not reacting to light.
That's a lot more blood than expected.
He's probably anticoagulated for AFib.
Okay, so we see a large external wound, so he's potentially got a depressed skull fracture as well. They mentioned the patient's bleeding a lot more than they expect, and so could the patient be anticoagulated? So these are medications that stop your blood from clotting. You can't really tell on a quick visual inspection if someone's anticoagulated because there are so many other factors, like the size and nature of the injury. How deep the injury is difficult to ascertain, first of all. If there's a particular blood vessel involved, if there just hasn't been enough pressure applied to it, or if the clot has just been disturbed. However, it is super important to find out if anyone with a bleed is anticoagulated. And this person is more likely to be because they have AF on the monitor, and one of the treatments for that is a DOAC, as the doctor has pointed out, which stands for a direct oral anticoagulant.